offer here at the university, but in our partners, our strategic partners, and it's a real pleasure to see so many of our strategic partners joining us this afternoon. Thank you so much for being here. And in our communities, investment in our communities, because actually health and social care, we all are engaged in the enterprise ultimately to provide better health and social care solutions for our citizens. I will just say one or two words, and then I'll won't interrupt the flow any longer. And sadly, I will offer my apologies. I'm not able to stay with you for the entire afternoon session, but I'll stay with you as long as I can. But that investment I was referring to is quite tangible here at Bucks, and we really are committed to growing our health and social care provision. It's a very significant element of what we offer here at the university. It will become increasingly significant, reflecting, I think, the priority that the government is placing on the reorganisation of health into integrated care systems. And that's one of the driving reasons behind our intent to bring health and social care together. But it's reflected as well in tangible investments in the delivery of new programs. We are launching this year new programs in midwifery, in physiotherapy and paramedicine, and that's on top of the new programs we've initiated over the last few years within our broader health provision. And we're very pleased with that expansion, and we expect to see it continue. And we've expanded too. Many of you will know we have had a long association with London trusts, and I'm delighted, as I say, to see many of our partners here today. But we've expanded through our operations in Buckinghamshire, particularly based at our Aylesbury campus, where we've built new facilities to support simulated learning in the health and social care professions. And as well, we have created, I think, a genuinely innovative solution here in Buckinghamshire with many of our strategic partners, the Buckinghamshire Health and Social Care Academy. It's an independent partnership-based organisation with around 9 or so different partners. I won't name them all here, but it is genuinely an exciting initiative, bringing together education providers, funders, primary care networks, healthcare trusts, together to ensure that, acting in concert, we're offering to the citizens of Buckinghamshire and beyond the very best we can in terms of health and social care, backed up by quality education and training. I hope over the next few months and years we will see that Buckinghamshire Health and Social Care Academy develop as we expect it to. But it is, I hope, you'll see an emblem of our ongoing commitment in health and social care and our intent to expand and develop the quality of our offer. So on that note, I just want to hand back to Karen, but just say thank you so much for joining us. It is a shame this is a virtual event. When we're able to, you must come and visit the university and enjoy some physical hospitality that we'll be only too pleased to provide you. So on that note, thank you very much and enjoy the rest of the afternoon.
Thank you so much, Nick. And the virtual bit, I think, is what the piece that's given me the most nerves at the moment. If you could see what's happening behind the scenes. So I know you know this world, so please all be patient with us. And we've got a couple of videos also that we hope we'll be able to share. So I'm going to just do a few slides and start opening the event. So hopefully, and I'm going to rely on Tracy to tell me if we've actually got
Karen, we can
slide
see
up.
it. It's all fantastic.
That's great. Thank you. So again, thank you, Nick, for those kind words. And I want to offer a very warm welcome and a thank you for everybody joining us. We've tried to schedule this a few times, but with the pressures of the pandemic and the hope that we might be able to be in the real world and not virtual, we delayed it. But it's quite timely, I think, now that we take this time to sort of outline to you what the Institute is and how you can engage with us, and also to very much welcome some of our speakers about some of the sort of key sort of sector priorities that are going on at the moment. And I could have had a very long list of presenters coming along, but I was trying to look at both nursing, sort of healthcare, the social work environment, and actually also respect where we've come in the last 14, 16 months as a whole community, really, hence the COVID part. So the Institute, we keep hearing about this, but the Institute's principal function is to be externally facing. In other words, it's acting as the front door for yourselves as external partners, and it will provide strategic leadership and oversight for our university's health and social care offer. You can see the overarching vision there, and it is ambitious because we are going to strive to be recognised for our work beyond our current regional engagement and hopefully have a national and international reach. Now, what I'm meaning by terms there of multi-agency and solutions and challenges, I guess a simple way may be to put that we want to work collaboratively with our current and new partners in areas such as education, research and knowledge exchange, because we want to support enhancements in your service provision, support implementation of policies, and to enable workforce development. The structure you can see before you is I've tried to simplify it. So there's obviously myself as director, and I'm very pleased to have taken up that appointment in October and been very busy behind the scenes to get to the point that we're at. I have the very able support of an executive assistant of Sarah, who's behind the scenes on the presentations as well. But we've got three key areas that we're looking at within the Institute that are sort of overarching and overseeing the great provision and delivery of our education schools. So the Institute will provide quality assurance oversight for our provision. We will be strategically looking at external engagement for our practice learning. And as we move forward, we'll be working around some cluster research activity. So the Institute leadership team is not just me. It's made up of myself, the Provost for Health, the heads of schools, and then we've got 3 health-related schools you can see there, and a dedicated representative from our Commercial Directorate and our Research and Enterprise Directorate. And the activities of the Institute will be informed by not only university objectives, but our health and social care sector needs, which we will be able to understand through an Institute Strategic Advisory Board. So this Strategic Advisory Board will comprise of the leadership team in the Institute, a visiting professor for mental health, and representatives from the Bucks Health and Social Care Academy that Nick has just referred to, a director of adult and social care representation, and also representation from our NHS partners, both in Buckinghamshire, Buckingham Healthcare Trust and our North West London partners and the primary care sector. So it's very much a collegiate way of working. Bear with me. So the key stakeholders, again, I could have many emblems here, but the key stakeholders include the university community, which is, and our practice partners, both in the NHS and the private, voluntary and independent sector, and our professional, statutory and regulatory bodies that govern our programmes. But I do want to make particular note to our work that we've been ongoing, certainly in the last 6 months, with the Institute and the Bucks Health and Social Care Academy. And as Nick may have referred to, the Academy is a non-profit partnership, and it's between Buckinghamshire Council, Buckinghamshire NHS Trust, the education providers in that area that includes ourselves, the University of Bedfordshire, Buckingham University and Buckinghamshire College Group. It also includes Health Education England and the Buckinghamshire Local Economic Partnership. The main purpose of this as a locality and geographically located, is to provide optimised health and social care workforce education and training for the best possible delivery of care for that population in Buckinghamshire. The reason I've made such a comment around this is because it's sort of leading its way and associated with the integrated care systems. And as well as working with this academy on a number of activities that we've been very much focused around place-based education. So aspects around safeguarding, advanced mental health practitioners, and reablement and continual professional development. What's also happening in the sort of northwest London side of our patch is I am co-chairing the West London Higher Education and Further Education Health and Social Skills Group, which is part of the developing Northwest London Employment and Skills Academy. So there's a lot of terminology there and a lot of language. I guess in simple terms, what I'm trying to say here, the Institute has got that strategic engagement, not only with the established academy in Buckinghamshire, but we've also got that strategic engagement with the Northwest London area. So for those of you who don't know us very well, we do have a campus in Aylesbury and a campus in High Wycombe, as well as Uxbridge. So they're the two main regions that we cover. But our education provision does go beyond those. The 3 health-related schools are the delivery pillars of our work within the Institute. So what I've done here is very briefly highlight some examples of the subjects that we currently cover. But please do visit the website for further information. I'm very familiar with the School of Nursing and Midwifery and Allied Health because I was head of school there until taking up this position. These are examples of the subjects that we do. It's broad, as you can see, but they're very much the way that we're working is across those 3 schools. So if you or your organisations would like to explore further any workforce development or service delivery opportunities, then please do contact me. As I say, the Institute is offering the front door to the university. Hopefully a short film will now start and you'll be able to hear it. Because it's virtual, this event, I wanted to try and showcase some of the dedicated health and social care facilities that we have. This is about 3 minutes long, and please don't judge me on my acting prowess, because I know I won't win any Oscars in this. Thank you for joining me. I'm Professor Karen Buckwell-Nutt, and I'm the Director of the Institute for Health and Social Care here at Buckinghamshire New University. I'd like to take this opportunity to tell you a bit about the Institute and how we engage with the health and social care sector. The Institute is externally facing and serves as the focal point for all health and social care activities across the university. It provides strategic leadership and oversight of all our health and social care activities. The 3 health-related schools, Nursing, Midwifery and Allied Health, Healthcare and Social Work, and Health and Social Science, are responsible for education and training delivery and are engaged in research to support evidence-based practice. We have an excellent track record of partnership working with health and social care service providers, both regional and national. These include NHS trusts, private and voluntary organisations and local authorities. We also engage with regional and national professional and regulatory bodies. We have great facilities across our 3 campuses that are specifically designed to support our health and social care programmes. We have invested in state-of-the-art simulation suites which enable us to replicate authentic practices across a range of health and social care environments. We already have a long history of delivering health and social care education programmes, and we have recently worked with a number of service providers, practice partners and service users to develop 3 exciting new programmes that meet the need of workforce development across the NHS. These are paramedic science, physiotherapy and midwifery. Our academics are experts in their field and they are dedicated to the student experience. In collaboration with our practice partners and other service providers, we are focused on preparing the future workforce for the health and social care sector. I've been able to give you a very brief overview of some of the facilities and activities that we have here at Buckinghamshire New University around our health and social care provision. If you'd like any more information on the courses we offer, please visit the university website. If you'd like to discuss any future opportunities, please do contact me direct. Thank you very much. Trying to come out of this now. Okay, well, hopefully there wasn't 3 minutes of silence there, that you could actually hear the film. Okay. Okay, Tracy, can you hear me okay?
Yeah, I can hear you fine. There wasn't 3 minutes of silence. You got lots of hand clapping and hands up. Well done, Karen.
Fantastic. That's the technology piece that was worrying me. Now I've got the pleasure of introducing some keynote speakers, and hopefully the presentations will either be operated by the presenter themselves, unless Sarah's been able to sort out a bit of technical issues behind the scene. So if we're able to get up the first presentation for Janice Sigworth, as that's going up, I'll introduce Janice.
Can you see that, Karen and everybody?
We can see it.
Great, thank you. So I'd like to introduce Janice to those of you that don't know Janice Sigworth, who's got a CBE, and she's got a clinical background on respiratory medicine and long-term conditions. She has a degree in nursing and a master's in health science management, and is an honorary professor appointment here at the university. Janice is currently the Deputy Chief Nurse of England, has been the Deputy Chief Nurse of England for the Department of Health, and is currently the Director of Nursing for Imperial College Healthcare Trust in London. She does have a national profile, and I'm really thrilled that she's able to join us this evening or this afternoon. Janice is also the clinical advisor for the NMC with regards to reviewing the pre-registration standards, and is a national professional lead for nursing and midwifery genomics. And as I say, I have great delight to invite Janice now to share some of the experiences of COVID, certainly from a London and acute NHS perspective. Thank you, Janice.
Thank you very much, Karen. It's lovely to be here, and your presentation, I think, sort of links in a bit with mine. And I'm delighted to be asked, actually, and a big hello to quite a number of my colleagues who I've known over a number of years, actually, who are with us on this meeting. You talked about whole communities, and COVID was very much had an impact on whole communities. And I think we came together as a whole community, particularly across health and social care, and the private sector, actually, that I'll talk a bit about, in partnerships to tackle everything that COVID threw at us, really. We've had a very good, long-standing relationship with Bucks. You recruit and train outstanding student nurses who we then take on to be staff nurses in Imperial, and we're always very pleased with them indeed. So tonight I'm going to talk to you a little bit about the impact of COVID-19 for Imperial, and I called it Superheroines and Heroes because all the photos in my presentation are of our staff. They really were. I felt very humbled. I'm very proud, actually, to be the nurse director at Imperial during the pandemic, and the pandemic continues. In fact, I'm in competition right now with Matt Hancock, who's broadcasting on Sky News about the new variant COVID-19 that's certainly sweeping a bit through northwest London and the north of England. So hopefully I'll be as entertaining as he is. So if we go on to the first slide, I think Sarah's going to do my yeah, so you know where we are. We're 5 hospitals on 4 sites. We've got 3 emergency departments, 1 at Mary's, 1 at Charing Cross, and an emergency department with the Western Eye for ophthalmic conditions. And we're a very big organisation, and we work with our partners in the integrated care system across northwest London. And that integrated care system came together particularly around critical care provision, but more generally to support patients and their families in our local communities through tackling COVID. Next slide, please. Just gives you a bit of our scale. Deliver about 10,000 babies a year, a couple of them royal ones occasionally. Got about 15,000 staff in Imperial. See 200,000 A&E, ED attenders. Come into contact with over 1 billion patients when we include our outpatients, day cases and inpatients. And we undertake about 20,000 operations a year. Next slide, please. So we've seen, you know, nothing like this in my lifetime or in any lifetime of nurses that I've spoken to, other than those, I guess, who've been deployed to some of the war zones. In terms of stretch of staff and how they've had to deal with the nature of the illnesses that the patients have come in with. On the right there, you've got a picture of a chap who's been wearing a mask all day, a nurse, and we, you know, the PPE, personal protective equipment that our staff have had to wear, which you can see on the left of the slide, has been a massive challenge to be able to deliver care with compassion and kindness when it's been so difficult in those outfits, 12-hour shifts, etc., to be in those outfits, in that PPE, and still deliver the level and standard of care that we've wanted to. You'll know with the pandemic, we've had about 4 million cases in England, 112,000 deaths in England. You know, it started in China. Public health emergency was called in January 2020 and a pandemic in March 2020. The symptoms are highly variable, from none at all, in my case, apart from losing my sense of smell and taste, to life-threatening and also to death. It's a significant global problem and it's had massive social and economic impacts on people's lives, and massively disruptional. And there are issues of race. It's disproportionately affected Black and Asian minority ethnic populations in London, and there are geographic discriminations as well. So it's really challenged our understanding of public health and equality and equity of health. And this all happened amidst things like the Black Lives Matter, the George Floyd death, and also the Sarah Everard death, evoking, as you know, political and public pressure through marches and other such like things. And it significantly affected our staff and our patients. And those 2 hearts were an initiative that we started because visiting was moratoriums on visiting. So if you actually had a family member in hospital, you couldn't visit them. So we gave you a heart and gave them a heart. Next slide, please. I thought the best way to get across kind of what had happened is an 8-minute clip of from ITV News, if you could play it, and it just shows some of the reflections really and experiences of our staff, and I'll come on after it's finished just to round up at the end. So Sarah, let's keep our fingers crossed and hope you can get it playing.
Yes, just one second. Karen, are you going to share that link or hold on?
You just need to click on it.
I'm just operating it now.
Thank you.
Are we there?
Yeah. Need some volume.
Just hear the word COVID.
Ooh.
Yes, Janice?
I'm from Hong Kong, so
Yeah.
I heard all about the infection from China, from my family.
I think I first heard about COVID on the news.
I kind of sensed that it was coming. We didn't quite know how bad it was going to be.
The first COVID patient was admitted on the 10th of March.
Melanie Dennison. I'm the lead nurse for critical care at Imperial. We were looking at potentially 3 or 4 patients per ICU, but we ended up having over 140 patients in our beds, which was a definite shock.
2 weeks later, all visitors were banned.
My name's Professor Anthony Gordon. I'm one of the intensive care consultants. We were expecting an illness that would be confined to the lungs, a pneumonia, but we learned pretty quickly that this virus affected more than just the lungs, it affected the whole body.
Apart from having a basic understanding of what PPE we should wear, we really had no idea.
I mean, there wasn't a single evidence-based medicine when this virus came on the scene.
Do we have enough oxygen? Do we have enough machines?
The constant worry that we wouldn't have enough nurses.
Nearly 700 staff were moved to the COVID front line.
Ernie Wong, I'm a respiratory consultant. Quite scary for the patients that suddenly we had to cancel all the clinic appointments because all the doctors were being, deployed onto the wards.
Nabil Saad. At the time, I was working in sexual health. They called me, said I had to be redeployed.
We reached capacity, around Easter time. I remember Easter weekend being very, very difficult.
April's peak saw 360 beds filled with COVID patients.
It was really intense. My experience of acute critical care is very minimal. And then I came here and it was just bonkers.
The hardest bit was seeing the patient.
I wasn't prepared for what I saw.
Suffering, dying, like that.
The life kind of going from them is extremely harrowing.
On the 4th of April, the Trust saw its deadliest day.
You'll get stronger. It will get better every day.
The thing is that we are all in our PPEs, so we cannot. So the only thing that I could help is my words to them. Just tell them that there's hope. Don't give up.
My name's Claire Ross, and I am the head of respiratory medicine at Imperial. This time last year, several of us made our wills, which I think puts it in perspective.
Not only do you think about infecting potentially other patients and other colleagues, you think about your family at home. Is it safe for me to hug my children?
My name is Julie Lacking, and I am the domestic of the ward. I was just really scared. I was really scared that I ran away from the ward, actually.
Julie's colleagues encouraged her back.
No retreat, no surrender. There's no way to run. There's nowhere to hide. So you are here already. We're here already. So go on, fight.
Nicholas Joykeran. I'm 55 now. Yeah, looking cool.
Nicholas is one of the lucky ones.
I went in on the 1st of April. I felt like death was in the room.
Do you know how close you came to dying?
How close? Yeah, severely close.
When he was in intensive care, 132 others were on ventilators.
And then in April, our numbers finally started decreasing again, which was a huge relief.
I was happy at first, I think. I think there was an overwhelming sense of how long could we really keep up this massive effort for. So it was really nice to have a tiny bit of a break, a bit of a reprieve.
Whilst some batteries were recharged, whole wards were repurposed, research continued, and non-COVID surgeries restarted.
We had missed a whole cohort of patients that needed to have very urgent elective surgeries. So in the summer, as an ITU, we were really busy catching up on all of those elective cases.
How hopeful were you that was it? We were through it?
Yeah, not very hopeful.
September, October time, it is almost sort of reminiscence of how it started, in early March.
The feeling was that here we go again.
The difference between the first and second wave was quite marked.
The first surge was very, very rapid, and we actually had more patients in beds in the second surge, and we had more turnover of patients through our beds as well. So the second surge was much longer and with much greater patient numbers as well.
But things had changed thanks to research.
My name is Dorota Banach. I'm a clinical research nurse. Research has been always extremely important. Without this, you don't have a medicine.
More than 4,500 patients signed up to health trials. Not all survived, but all have helped.
They've probably been told by one of us that they are likely to need intensive care, likely to be put to sleep, and at the same time, within the same hour, often, we were asking them to take part in a trial.
They worked hard to bring me, to look after me. Could you stop a minute?
Nicholas took part in one of Imperial's 31 different studies.
It shows collective spirit in fighting off coronavirus.
Without them, I wouldn't be standing here talking to you. Without them, I wouldn't be able to enjoy my grandchildren, you know, my wife, my kids. It's through their learning that's put me back out here.
Many of the drugs available now have been possible because of Imperial's Biomedical Research Centre, which helps turn lab-based science into practical treatments.
We learnt in the summer that steroids such as dexamethasone help. That helped a bit. Now we've got these other two drugs, tocilizumab, saralimumab. That helps further.
My name's Tim Orchard. I am the Chief Executive of Imperial College Healthcare. The mortality rate was about 13% in our ITU compared to roughly 30 in the first wave. So big difference. And that was because we were able to pick up the lessons. That research was able to feed directly into clinical care.
We're seeing a lot more patients survive, and I guess that has a flip side because you're seeing sicker patients now survive intensive care.
Can you say your name for me, please?
Yes, it's Richard Tolmash.
They will take longer to get better, but we're confident they will get better.
They put me in induced coma and on a ventilator, and I stayed on that for about 8 days. I was like a walking skeleton. You lose so much weight and you lose your muscle.
3, 2, 1.
The Trust are now supporting 800 people still struggling with the after effects.
The full extent of long COVID is unknown, and I think we are going to have to monitor that very carefully.
My name is Dr. Sarah Elkin, consultant in respiratory medicine. Is there magic pills? No.
Treatment relies on a range of therapists.
We are seeing from hospital discharge patients that the recovery is excellent.
On a scale of 0 to 10.
The cohort from the community are different.
How breathless are you?
They tend to have had a milder disease and have myriad symptoms such as breathlessness, chest pain. Most people will say it's just taking longer than they thought.
So far, 842 people who have tested positive for COVID have died at the Trust's hospitals.
It was heart-wrenching.
Terrible.
Stressful.
An awful lot of pressure.
This has been the most challenging year in my professional career.
I think we've all been tested, in one way or another. As a team, we've become a lot closer. We were colleagues, and I think we can definitely say we're friends. We're great friends within the hospital. That's the one thing I think we're really lucky that we had each other during a really difficult time.
I just hope that it will not come back.
Thanks very much. Do you want to go to the next slide?
Sarah?
Hold on, yes, just doing that now. Here we are.
Brilliant, thank you. That's it, brilliant. So we've called it the first and second surge. So you heard about Easter, the gap in the summer, and then into the autumn. And we're now planning for wave 3, third surge. The heroic efforts of the staff, the volunteers, our charity and our students actually, and all of you from Health and Social Care helped us in Imperial, and I think helped the whole system cope with COVID. And we were so much stronger together, and you heard in that clip, teamwork at every level is so important. There was a constant challenge to find enough nurses, so please train as many of them as you can, Bucks. You heard that we did redeployment on an industrial scale. We had to redeploy 1,000 people in our organisation. to help the COVID challenge. And research was done at a rate and pace not seen before. We do work in Imperial, and it's got a very proud and long tradition of finding cures and all kinds of innovative solutions to disease and illness. And you'll have seen on the news variously all the things that the college and the scientists in the college have done, and very grateful to them we are. We've had lots of support for our staff from local communities, from retail. We got 8,000 Easter eggs, for example, delivered to the Hammersmith at Christmas and had to distribute those. I'm so grateful to Leon, the food outlet, for providing hot food for those staff who couldn't come out of those areas that you saw. So it was a really big, massive effort all round. And we tried to support our staff in the best way that we could. There's no doubt that the psychological impact and the post-traumatic stress of what we saw and what we did and what we heard about during the first 2 surgeries will live with many of us for some considerable time. Next slide, please. I just wanted very briefly to pay tribute to the staff. COVID didn't discriminate, as we saw with Boris Johnson. Actually, my boss, Tim Orchard, didn't discriminate who it affected, and there was no way of knowing how bad you were going to get it. And these are the colleagues that I worked with at Imperial who died from COVID during the pandemic, and it cast a very, very dark shadow over our work and over the families and friends of our colleagues. Some are nurses, some are doctors, some are cleaners, some are technicians, and there was extreme sadness and a lot of fear. You heard from Tim that we learned quite a lot in the first wave, and the treatments and such like meant that we were able to save more lives in the second wave. But it was very dark days when these colleagues passed away. So I just wanted to remember them. And we also had colleagues who recovered. And again, you'll have seen on the news some of those, but it, was touch and go for some of them. And we were so grateful when we waved them off out of the hospital, recovered and going back to their families. Next slide, please. So we're now in the second reset and restarting of our services. Our Filipino nursing community were disproportionately affected both with illness and death, and we've got a network now, a support network out and about in the trust. We've got large waiting lists as a product, and you heard from Melanie in the film that the operations, we need to get cracking and get as many of the operations that we've had to postpone to cope with COVID completed now, because there are patients and the public at home waiting. And we're planning now for our third surge, and we're also tackling visiting, because that really was locked down during the first and second surgeries, and it was very traumatic for patients and their families when they couldn't come together as they would usually do during sometimes very difficult times and diagnoses. So visitors are back in, not fully. And our staff, just there on the left-hand side, our staff have been coming into work day in, day out during the last year. And as I say, I'm very proud of them for doing that and putting their patients first often. Some of them in redeployment have lived in hotels and been away from their families. And some of them have come in long distances to work and braved all sorts of methods of transport to get there. We've interestingly vaccinated now 15,000 staff. We've given 35,000 doses of the vaccine. If you haven't had the vaccine, think long and hard. And if I were you, I would get it. We've also established 2 mass vaccination centres at Marble Arch and Hammersmith. We've established across the ICS, I think, about 15 mass vac centres. And from an Imperial point of view, we've vaccinated 50,000 members of the public at our mass vaccination centres. And it's likely we'll be trying to double that as the new variant starts to take hold across London. Next slide, please. And just finally, we have had lots of celebration, and we need to carry on thanking and celebrating our staff's contribution. We had International Nurses Day on the 12th, and Midwives Day on the 5th. And these are some of the celebrations that we had. We've had lots of Making a Difference awards, and thanks to our staff, as I know colleagues have across North West London. In the middle there is Winnie Thomas, who's our matron for quality in surgery, and she received a British Empire Medal and a CNO Gold Award in the last 12 months. Winnie was absolutely instrumental in helping our Black and Asian minority ethnic nurses and midwives, both with the risk assessments and making sure that they had the correct PPE, and if they were vulnerable, shielding or otherwise. And they also developed head cap, which we didn't have in the NHS, for nurses from Black and Afro-Caribbean groups to protect their hair when they were in aerosol generating clinical areas and also in our general ward areas, because of the nature of their hair and cleanliness and going home and feeling safe. So we're very, very pleased with Winnie's achievement. And we're also planning a gratitude week in early July to thank all of our staff more generally, because I say it's been a massive, massive team effort. And I'll stop there. I could go on forever, but I know we've got some very eminent folk to talk after me, but I hope that gives you a flavour of what we've all done together. And I'm sure every one of you sitting listening to me has played their part in enabling us to look after our patients and our communities during this ongoing pandemic. Thank you.
Thank you very much, Janice. You can stop sharing at the moment if you wish, Sarah. We did start a few minutes late because we were waiting people to join us, so I am mindful of the time, so hopefully people can be a little bit patient if we run over beyond 6 o'clock. Thank you very much for reminding us just how it affects people personally. I think that film was very powerful, and it also is a reminder, as much as that was a focus around an acute London trust, I think it represents so many issues that all hospital trusts face, and what we mustn't forget either is the care sector and the care homes and what they experienced. And I'm sure that there may be something that Deborah in her presentation may allude to as well. So we have got a minute or two I'll make for questions. There's been mainly thanks and gratitude in the chat, Janice, for your presentation. But if anybody's got a burning question or comment they wish to raise their hand, please do so now. You were saved by technology, I think, Janice. Okay, so no, just a thank you very much. So that's great. Just to let everybody know, we will be sharing the recording of this launch. It'll be on the university website, so we can revisit some of this. So again, thank you very much for your time, Janice. Bye-bye. Okay, so I'm going to hand over now, because Nicola's been in and out of the meetings. Hopefully she's still with us now. So whilst Sarah's getting up the presentation, yep, there she is. Oh, and she's got a picture there. Okay, so Sarah, are you able to do your presentation, or is it going to be Nicola?
Nicola, I think, is going to do it, because we can't, we haven't been able to share it, unfortunately. We can't open it. Okay. Nicola is aware, and I think she's going to try and do it.
Hello, everyone. Thank you for having me. It's an honor to be invited. I'm having some trouble with sharing because I'm not an organizer, so I can't actually. It's only the organizers who can share their screen. So I was trying to rise to the occasion, Karen, to see if I could share on my iPad, but I think it's an epic fail for me. So what I might do is just talk through my slides. I will share these. They were quite large, so they couldn't be attached.
Okay. So thank you for bearing with us with the technology piece then, Nicola, but I'd like to just introduce you first. So Nicola has got a background in older people and a master's in nursing research and practice development. And she has held a number of key positions, including Assistant Director of Nursing, Head of Clinical Quality, and Head of Nursing. And she's currently Health Education's England Regional Head Nurse, Regional Head of Nursing and Midwifery for London. She's been awarded fellowships for the Royal Society of Arts. in recognition of her work as a blogger and a flogger, if I've pronounced those correctly. So I think you're very familiar with the technology, which is probably why you're able to adapt as you have been able to. So I think one of your greatest honours has been leading that procession on and lamp bearer at a Florence Nightingale commemorative service, and it's quite poignant to say, as we say, it's only last week that it was International Nurses Day. So I will try and keep you to time, because it might be a little bit harder with you not sort of going through your PowerPoint, but we will try to make that available, as I say, after the event. So thank you very much, Nicola, and over to you.
Thank you very much. Thank you for having me and for that wonderful introduction. It's a point in time for me. Oh, I think it might be working. It's a point in time for me to be talking after Janice's presentation about the impact of COVID on our workforce. So as we think about how we reset and recover as much as we can from the pandemic, I think it's time. It is an opportune time to come and join you for the launch. So the title is Bringing the Nursing Workforce into the Future, and who knows what the future will look like. But we have some idea of what we've learned in the past year, couple of years, and where we need to get to. Next slide, please. So, we're mandated to ensure that we provide education, training, and deliver and support for staff so that we have the right numbers at the right place with the right values. So it's important for us to deliver on our mandate. But we can't afford to be working in silos, so collaborative working is really important for us. And it's important for us to reach out and to understand what's happening with our partners and to be supportive as we lobby the government for additional funding and additional recognition for what we do. Next slide, please. So look, just a snapshot of what London looks like. I know you cover other areas, but I thought I would just show what London looks like at the moment. So you can see it's quite large, 9 million people. And we have a healthcare system that's first class. We have work to do, but we have 5 integrated care systems, number of CCGs and so forth. But I just wanted to give that snapshot about where we are in terms of London healthcare. Next slide. So yes, we've been reviewing, and we get asked a lot, what is the impact of COVID? And we're in the middle of the pandemic. We've seen the worrying increase of the Indian variant. I'm being asked a lot about what are the intentions of staff. So we've heard anecdotally that staff are saying that they are considering other careers, but we're not sure how this will pan out. So time will tell. We're working with our partners at NHSEI to kind of keep track of vacancies. So as of February this year, the vacancy rate was 11.6%, which equates to just over 8,000 whole-time equivalent nursing vacancies. But this has fallen from a year previously, and we've seen the increased interest in healthcare and nursing careers. So we'll see what that means for the nursing workforce as we look. But that chart just shows where we were a couple of years ago and where we are now. So we're going in the right direction in terms of vacancies, but it's the retention. After staff who've experienced what they've experienced in the last years, how do we retain, how do we support them so that we're flexible in our thinking as well? Next slide, please. So yes, and again, just another way of looking at the nursing and midwifery workforce with a little focus on Northwest London. It's very diverse. We've talked a bit about the impact of COVID on people from ethnic minority backgrounds, but it's just to show how diverse we are and to ensure that when we're looking at courses, opportunities, that we are ensuring that the people who are least likely to take up these courses are encouraged to apply to become nursing associates, and I'll touch a bit on that later. So in terms of nursing, what we've seen is that there are people who have never considered a career in health who are now coming forward and wanting to know more. We see that as part of our We Are the NHS campaign. We see that in schools. So we're working to ensure that we attract the right people with the right values and showcasing what a career in nursing could look like. Because there's still some stereotypical views of what nurses do. And it's important for us to show the areas of development in terms of advanced practice, research, management, policy development, strategy, education. So it's an exciting time. And it's a time for us to be agile and think about what we've learned through the pandemic, what we need to take forward, and what we've kind of got rid of red tape and silo working and taking that into the future with us. So I feel very strongly that we must use our nursing voices locally, regionally, and nationally. And I would add internationally to that as well, because of our influence in terms of international recruitment and global health. So our voices united is much stronger than working on our own. A first priority, just looking at some priorities at HE, and I don't think there'll be any surprises here. The Nursing Associate Program is a key priority. I won't go into detail. The slides will be available, but you'll be able to know that the Nursing Associate, the NA role, is a support role. And I just want to say that, in all our messaging, we need to ensure that everyone is aware that this is a complementary role. We're not trying to remove other roles to make way for the nursing associate. It's actually looking at the workforce as a whole and thinking about how this role could complement existing roles. Mental health is really important. So ensuring that we have highly skilled, well-trained staff and supporting them throughout their careers as well. So we're working very closely with the ICSs and the HEIs and the trust to ensure that we prioritize nursing associate, mental health, and the next slide, please. Primary care. Now, as an acute nurse, I have to remind myself that I am advocating for all sectors of care. And in terms of primary care, is expanding the GPN roles and ensuring that we have primary care as an attractive option for people who are at the earlier parts of their career, so that we have a workforce that are able to be adaptive and can work in different sectors. So it's important that we transform primary care. Lots of work has gone on, the 10-point plan, and now we're looking at the next steps after that. Urgent and emergency care is another priority, widening participation, looking at differential attainment, as I said, looking at our local community and ensuring that we attract people who have a vested interest in ensuring that their local healthcare expands and continues. So domestic market is really important. Next slide, please. So I think everyone is aware of we call it the 50K, but it's actually the manifesto promise of having an additional 50,000 nurses by March 2024. That's in the face of retaining our current staff and also pre-pandemic. So in terms of the 50K, the domestic supplies where HE really steps up, and we're looking at undergraduate and postgraduate expansion. Placement capacity is crucial, and we'll come on to that a bit later. We want to amplify the learner voice, so we'll be setting up a regional student council in the next couple of months. But we're looking at our surveys. What are our learners telling us and acting on it? No point keep going out with the same survey and not responding to the feedback. So we're looking closely at amplifying the student or the learner voice. Looking at retention on programs, the blended learning, see what we've learned from COVID in terms of simulation. How do we take that forward? And how do we ensure that everyone who enters a course completes it and transitions into the workforce? Return to practice is another priority. We've seen with the temporary register and supporting staff to transition onto the permanent register and using different flexible ways of having tests of competence. The apprenticeship routes, as I said before, the blended learning approach is all part of the priorities that will be taken forward as we reset and recover out of COVID. Maternity, primary care, as I said before, and mental health. So looking at new roles and looking at suicide is a really a topic very close to my heart. Suicide prevention, not just in students, but in staff. And we're doing some work with our repair fellows that's reducing attrition and promoting increasing retention fellows at HE about how do we support people in the workforce to prevent them committing suicide. So that's really important for us to expand on in the next couple of months. Allied health professionals, my colleagues who are in AHP roles, they remind me to remember that we cannot do it without them. There are about 15 roles that are designated as allied health professionals. And we're doing some wonderful work at HE London with our AHP fellows and having listening events. They've done some listening events and they've focused on equality, diversity, and inclusion. And there's a powerful video that they've developed that is being shared, and I will find a way to get the link for you. But it's just listening to staff who have experienced the pandemic and coming out of that and their priorities as we go forward. Advanced clinical practice, clinical academic careers, a lot of work is being done in terms of that as well. And I think this is the last slide on priorities. We work very closely with the quality, patient safety and commissioning team. So you'll already be aware of the education contract, the student data collection tool, different audits, looking at the placement gap and the capacity, and how do we have innovative solutions. And our workforce transformation team have developed this innovative 6-step program where they're supporting trust and primary care organizations, and I'm sure they'll be able to work with HEIs as well about workforce transformation so that we can grow the next workforce for workforce transformation as well. No, placements. I had to really think long and hard about what I would say about placements. But as we have more people coming forward to take up these courses, we need to think about how are we going to place them. So we recently held a series of seminars. We did them with the branches of nursing. And I just wanted to share some high-level themes that are coming out and to see if they resonate with you. And if anyone on the call would like to have conversations offline, I'm really welcome to hear about innovative and radical solutions to the placement agenda. So in terms of the first theme, it came out strongly that quality of the learner experience. It's not just about creating more placement and just sending people in, it's about the quality. So if we're using simulation, it's how do we use it appropriately so that we have a workforce that are ready, feeling competent and confident to transition into the workforce. So the quality of the learner experience, even during a pandemic, is really important for us to get right so that we have mentors, preceptors, education facilitators on hand to ensure that students are not adversely affected by the experience. The second theme was about the placement organization. What we heard was that we need to work together as a region, even multiple regions where we have the timing of placements is considered. So we avoid the pinch points. Someone said sometimes they have 20 students, at other times they have 2 students. Now we need to look at it throughout the year and standardize it so that we have a throughput that is manageable so that we can maintain that quality that we talked about earlier. In the impact of COVID, now there is the impact of COVID on nursing study that has been done, and that has really, the themes in that resonate with the NET survey. So we're looking at that at the moment and thinking about virtual consultations, the impact on existing staff in terms of having students in that space, and again, placement gap and how we time the placements so that we have increased numbers of learners as well as improving staff morale. We also need assurance that roles will not be replaced. That was my point earlier about the nursing associate, that people don't feel threatened when we have innovative new ways of working, that we realize that it's to complement the existing workforce. And thinking about career opportunities on a page where someone who is new to healthcare can see that they're transitioning from another sector in the economy And they're coming into healthcare and they start as a support worker or as an apprentice or as a nursing associate, and where their career could go and what the opportunities are. That's quite powerful, and that came through. So the next steps in terms of HE London, in terms of placements, is that we have to be radical. We need to look at ways of getting placements in unconventional areas. We need to be innovative and we need to collaborate. We cannot get there on our own. None of us can. It's only by working together as partners and networking across specialties and disciplines that we'll have that quality improvement and co-production. I think the voice of learners has to be amplified because they are the future, and we need, whatever we do needs to be based on what's actually happening now, not what we had in our day and in our time. And thinking about how we integrate the voice of service users in everything that we do as well. I think it's important for us to realize that we are the future. So I just wanted to end there and thank you.
You got some. Thank you very much. Got some feedback there. So thank you very much for your presentation. And we got there in the end with the technology. Fantastic.
We did. That was just sent to test us. Yes.
Indeed. So a little bit of feedback. So sorry about this. What I'm going to do in the interest of time, Nick, I'm going to move us on straight on to Deborah. And then if any questions do come through, or if we've got a chance at the end, we'll pick those up. So thank you again. Very insightful, especially with regards to those placement capacity issues. So thank you, Sarah. I'm going to hand over to Deborah now. And Deborah, you know your time limit, so we'll keep to that. And what we'll do, because of the programme slippage a little bit, I can shorten my piece at the end with regards to sort of feedback and questions, because not too many have come through. And so I'm going to hand over now to Deborah Sturdy, OBE, and I'm thrilled to be able to do this. So Deborah's worked with older people, both in health and social care throughout her career. Again, she's held a number of positions that is included being the nurse advisor on older people for the Department of Health. And she's been Director for Health and Wellbeing at the Royal Hospital, Chelsea. She has an honorary professorial appointment with us here at the university. And in December 2020, she was appointed as the inaugural Chief Nurse for Adult Social Care, and is working with the Chief Nurse of England and the Care Minister, and advises in a strategic nature. So I'm very excited to hand over to you, Deborah, and very excited that we're able to really put the social care aspect of this onto the agenda. So thank you.
Thanks very much, Karen, and great to be here the sort of late afternoon to at this launch. It's very exciting for the university, so really pleased to be here. Can I have the first slide, please? So social care is a complex beast. So it's been great listening to colleagues from the NHS, but social care has its own unique set of challenges and I think opportunities as well. So one of the things about this new role is to be able to influence both the ministerial team, but also civil servant colleagues, and be that champion not only for nursing but for the workforce more broadly in social care. So really delighted to be in this post. It's complex and it covers a lot, you know, as it says there on the slide. It's learning disabilities, mental health, physical disabilities, autism, long-term conditions, older people, dementia. I mean, the whole lot. It is a complicated landscape. Next slide, please. And in that complicated landscape is a really huge workforce. The workforce in social care is bigger than that in the NHS. And I think we often forget that. Last week, myself and some colleagues met with Health Education England and the fairly new chief exec there, and she was actually taken aback when we said actually our workforce, not it's a them and us, it sounds like it, is actually bigger than healthcare. So I think that's one thing that we we just need to remember in the context when we think about the new opportunities that are ahead of us with the integration agenda, that there is a lot of skill and expertise in this workforce. But there are huge challenges as well, and I think the challenges particularly sit around the stabilising the workforce. We see a huge turnover of staff. How do we actually stop that happening? We see a 40% turnover of registered managers in the registered services. Again, that has, as we all know, everyone sat in this evening's lecture, is that we all know that creates an instability in the workforce more generally and has an impact on the quality of care. So actually stabilising the workforce is really, really, I think, one of our biggest challenges, as well as recruiting and retaining the phenomenal workforce that we have at the moment. And going back to Janice's presentation and the very heart kind of wrenching stories of the impact of COVID within the workforce at Imperial, again, I have to say that the work, the workforce in social care, how they've stood up and taken on and expanded their roles and embraced the phenomenal challenges we've seen as a nation and globally in the last 15 months has been really absolutely incredible. And up until January this year, I was working as Karen says, as the Director of Health and Wellbeing at the Royal Hospital, Chelsea. So I've kind of seen and worked on that front line myself. So, have to acknowledge the phenomenal work that they've done. The other thing about, I think, social care workforce is most of the care that's provided is outside the four walls of the care home. And we often think about care homes as being the kind of panacea of social care. In fact, most of the care happens in the community. So how are we going to develop that domiciliary care workforce? And I think, again, how do we think about that supervision of them? These are people who work quite a lot of the time in isolation, in people's own homes. How do we develop and professionalise this really, really important workforce as part of our communities? Next slide, please. So I think I want to just talk about some of the negative things. I think the challenges that nursing and the wider workforce face in terms of social care is it's often perceived as a sector where fools rush in and angels fear to tread. So it's the place you go if you're not good at anything else. And I think we have to challenge that perception of this being a dead-end option, no development opportunity, a lack of academic profile and investment. With sort of dead-end prospects, end of a career option rather than a positive career choice. And it's all about care homes. So I think that's the negativity that the sector and the profession have faced for some time now, and we have to turn that on the head. So I think the role, such as the one I sit in at the moment, is really important in being that champion and that kind of figurehead for kind of fighting back, I suppose, that outdated perception of what goes on. Next slide, please. So I think we need to define this new narrative for the workforce. So again, if you talk about a work in social care as a nurse, often people turn their head to the side and give you that kind of empathetic look as if they're about to give you some really bad news. And what we need to do is, and people think that working in a care home, as I've said, is an easy option. In fact, it's a really challenging place to be. Often, as a practitioner, you're working in suspended isolation. You are managing teams, you are coordinating care, you're taking advanced clinical decisions, often on your own, because there isn't, that person to ask next to you, and there isn't a machine that goes bleep, and you can't press a button and a doctor comes running through the door. So I think we have to start describing nursing and in social care as what it is. And I think in care homes, going from I work in a care home to I work in a nurse-led service. So changing that narrative, I think, completely changes the tenure of conversation. And then I think for nurses, you have to say, why wouldn't you want to work somewhere where you can practice autonomously? And I think the creativity and the scope to be creative in social care is far greater than the NHS. And I think it's something that we need to do much more in terms of telling and selling that story. I think it's really important that we start levelling up the professional recognition of nurses working in social care. And today I've launched the first chief nurse for adult social care awards scheme, which is replicating that of Ruth May in the NHS. So again, really important that we start seeing that kind of equity and recognition across the both the NHS and social care. It's about creating careers and not offering jobs, and I think we have to really shift our thinking around that. You know, often you see campaigns, recruitment campaigns that talk about jobs in social care, and we need to be really talking about careers. There are a plethora of opportunities, and I think we have to shift from that to be thinking about from novice to expert and all the opportunities along that career pathway. And as Nicole talks about, you know, nurse associates exist in social care, the opportunities to do apprenticeships. You might want to go and be a quality manager. You might want to go off and be a compliance manager. You might want to go and be a home manager or a director or a CEO of an organisation. And I just don't think we tell the story as strongly as we could. And I think it's about building connectivity and inclusion. I'll go on and talk a bit more about that. Creating leaders and recognise the ethnic minority groups and equitable opportunities. And again, Nicole's talked about that. I think we need to be doing much more for our colleagues from ethnic minorities in terms of creating those opportunities, particularly around leadership roles. And creating the excited, informed future leaders to take social care forward. I think that's really important. I think we need to invest in our leaders and actually enable and help them. And it's great working with people like Skills for Care who've done some work in this space, but I think there's more work to do, both from a nursing perspective and a wider leadership perspective around actually getting people to stand tall and be proud of what they do. And giving them the confidence, I think, to have the voice around the table. And like I say, celebrate and recognise success. And one of my tiny achievements in the 4 months, I think it's probably 4.5 months that I've been in this role now, is getting the first Nursing Times award for social care nursing, which might sound like a very small thing, but for the first time in nurses from social care will be at one of those national events, actually being recognised alongside colleagues from the NHS. And for me, that is incredibly important. Next slide, please. So what are these opportunities? As I say, I think we have to set out this pathway from novice to expert. We need fantastic carers who are going to stay in those roles. They're a really important part of our workforce. But actually, how do we set out that opportunity and that excitement and that potential for people right at the start of their careers? I think we really need to set that pathway out. And it was great talking to colleagues in the North East recently, where a CCG is going to invest in 6 care home nurses as an open competition for places to become advanced nurse practitioners. And there's going to be an evaluation around that. You know, those kind of innovative models you know, will give us opportunity to think about post-registration qualifications and specialist practice qualifications. And many of you will know about the Nmc Consultation that's out currently. How can we make that an exciting career option for people? And I was speaking at something else this morning, and there were a number of student nurses talking about this being the first choice when they qualify. So, you know, how brilliant is that? Because they've had an experience actually working as part of their training in social care. I think it's important that we build the academic underpinning and evidence around social care, the social care workforce per se. And I think it was 2 weeks into this role, I had some opportunity to bid for some money. So we are doing some scoping work at the moment about looking at the role of the nurse in a care home. I expect that there'll be further research for other parts of the workforce, you know, as we start that ball rolling. I think it's really important that we have our own UK evidence base, rather than often what we do is look for North America, Australia, and often Scandinavia. I think we need to change the undergraduate experience. You know, interesting listening to Nicole. I've, you know, reached out to her, very keen to talk about the opportunities for undergraduates in having that experience, and which is great to see the work that Bucks are doing by kind of creating this institution. I have been, I think it's in September this year, I would have, it's 40 years since I started my nurse training. And as a student nurse, I actually spent time in a care home. I remember every single shift of that. I worked in day services. I think I did a Meals on Wheels placement. And that widest understanding of the community has kind of stuck with me. So I think that's a really valuable part of the undergraduate nursing experience, but not only for nurses. I think we should be exposing our paramedic colleagues, therapists, and medical, undergraduate medical students actually to understand social care, because we want those future doctors who are receiving people in A&E to understand where they're turning them around and going back to. I think it's really important. And as we think of the structures and the changes around the integration of health and social care, even more important that we respond today, but think of that future workforce. I think, I've touched on this, but creating that postgraduate qualification in nursing and social care is really important. We need that well-educated workforce, evaluating the impact on care quality. I think it's integral. If you've got well-educated, informed people, it's going to improve quality. I think we need to build a knowledge and skills framework which supports lifelong learning. So, if somebody does want to stay and be a care assistant, let's make sure they're the most fantastic care assistant. As I say, creating that academic base. For me, one of my kind of personal dreams would be to the appointment of the UK's first chair in care home or social care nursing. I think to see that happen and come to fruition is really important, because it's about creating that kind of expectation, I think. And again, this thing about levelling up, people being seen as being kind of equal in the world of academia as well. And creating that pathways momentum and and qualifications in specialist practice. Next slide, please. I think we need to create this belief and confidence in what social care offers and the complexity of what it does. And I think that the sector itself has not always been good at describing all the things that it does. We need to build that momentum. One of the great things about the role that I hold is that I have a dotted line into Ruth May's team as the chief nurse for the NHS or the chief nurse for England. And I sit on her senior management team meetings, so already being able to talk to colleagues, creating some of those dialogues, particularly around the integrated care systems, and already saying, so where's social care nursing going to sit in terms of that? And I think that's really important, that we're seen as at the forefront of those conversations, not as the afterthought. So a number of really positive conversations about where nurses sit in ICSs from a social care perspective already starting, and I think are critical to make sure that we're not just seeing ICSs as a primary secondary care, but actually being totally about system. And again, this week, talking to somebody who's doing some work for Ruth May about how are they going to prepare those nurse leaders in ICSs who are perhaps coming from a very acute based NHS experience into understanding the wider system and building around those kind of masterclasses and that exposure and that understanding. So it's absolutely critical that that I can help influence that at this point. And as I say, changing the perception, changing the outdated thinking and myths. And this is a really important that we have the most skilled workforce, because often these, as I said, most of these people are working in an autonomous way. So I think in terms of the social care reform programme, and I know that people were disappointed about the Queen's speech, but I think the workforce bit of that will come, and I think the workforce part of the reform programme is absolutely critical. And I think as I say, it has to be a first-class career choice, not a second-class option. So it's all about that levelling up, and it's all about us telling our stories. This is complicated, it's diverse, it's challenging, it's interesting, and it's complex. And again, I think that the more that we talk about it, rather than just people kind of brushing it aside and kind of not really seeing it for what it is, which is absolutely a fundamental part of our system. And we can't cope without the NHS. but we can't cope without social care. And again, somebody who was speaking this morning at the event I was at actually talked about social care has been around probably longer than healthcare has in many ways. So, you know, we should kind of just remind ourselves that, you know, this is not something new. This is something that's been there for a long time, and we should really treasure it really as a really important part of our society. Next slide, please.
Deborah, I know you're very passionate, but I might just need to move you along a little bit.
Okay, I think I've covered most of this in this one actually. So I think there is a commitment to social care reform. It's about choice for everybody. I think we can see some innovation between the joint health and social care opportunities, and particularly around the ICS structures, and I think we've got to get on the front foot about that. And I think the great work we've seen about the enhanced health and care home programme throughout the pandemic, building on that, which is really starting to see kind of social care and health coming together in a really positive way for people. And I'll leave it there.
Thank you so much. You probably haven't seen or been able to see the chat, but again, a lot of appreciation for what you're bringing up, and certainly raising that profile of the social care. And you're right, sometimes it does feel a little bit like it's in competition of NHS and nursing to health and social care, but absolutely it isn't from our perspective. That's why we're very much supporting that integration of the health and social care agenda, and I see the Institute very much sort of driving and supporting those sort of activities. And I'm going to say a thank you to Martin Green with your endorsement of setting up the Institute at this point and what we're trying to do. So I did notice that in the chat. So thank you very much to the speakers. We haven't had too many questions, which I think is sort of represents the fact that what you've been talking about absolutely is clear to them and makes some sense. If anything does come through, then we can follow it up post the event. But I'm going to just hand over to Gavin now, the Provost and our Deputy Vice Chancellor, for any closing remarks that you might want to make.
Karen, thank you, and enormous thanks to our speakers, who I think have given a really uplifting series of talks. It's been great to hear what's been presented, and of course we've been through some really tough times over the last few months within the health service, but thank you to everybody, and thanks to everybody for joining. I mean, we've had 114 attendees today, which I think really speaks highly really with respect to the amount of interest there is within the university, but actually outside of the university. We have a number of guests who've joined us today as well. So as I say, special thanks to Janice, Nicola and Deborah for those excellent presentations. A couple of words I'd just like to say, and it really reflects on where we've come from. So we've come a very long way in a period of just over a year. So I remember the first meeting that Karen, Paul Morgan, Lee Curtis, David Sainz and myself had around the beginning of 2020, where we considered establishing the Institute for Health and Social Care at the university, really to support the growth and expansion of our health provision. And I think we can see already that the opportunities here are very significant. In addition to Karen, Paul, Lee and David, I'd like to acknowledge the help of so many people from across the university, and indeed the health sector and friends that we have on the call today, because it's through your help and support that we've been able to push ahead so quickly and to deliver on our vision for what the Institute will represent. And we've now got to demonstrate that over time, but I think we're really well positioned now to launch the Institute in the way that we've tried to do today. And I'd also like to say a special thanks, of course, to Tracy Brienza, who's really helped with organising the event. I think we've heard throughout the presentations today, health remains at the forefront of our lives in a way that's not been seen previously. I don't think there's ever been a more important time for us to focus our efforts and engage in health education, research and provision, and the Institute will play a key role in this agenda going forwards. We're open for business, partnership and collaboration, so please do continue to engage with us. And finally, I'd just like to say we'll be launching a public health and social care public lecture series and a number of stakeholder events over the next 12 months. We'll be in contact with you because we've captured your contact details as a consequence of you enrolling for this event, so you can't escape. But we really do want to continue to engage and grow our relationship with everyone on this call as we go forwards, and also keep an eye on our website. Finally, have a great evening. Thank you all for attending, and I look forward to seeing you in real person speak next time. But thank you again for coming along.
Thank you. Thank you, Gavin. Good night, everybody.
Good night.
Good night.